Hi, we're going to just have another review. I thought it was a good idea to just go through the vital signs again, since so many of you are cyber and it's been very difficult to get all of you into the lab to practice these skills. This week we'll have taking a patient's temperature, pulse oximetry, and their respirations. And this is just indicative of a monitor that is able to pick up the heart rate, blood pressure, oxygen saturation, respiratory rate, and the patient's temperature. When they are in the hospital, many times in the emergency room or in the critical care units, perhaps even on a telemetry floor, the patient will have a monitor on that will actually keep track of their vital signs intermittently throughout the day, and it will record them and show any type of abnormalities, and alarms will actually go off to alert the nurses that someone is out of range. Okay, first, I know this is quite a crowded little slide over here. We're going to talk about temperature. There's so many different ways to be able to take someone's temperature nowadays. This is a thermometer that's used to take temperatures of water or shower, bath water. This one here would be an oral thermometer, an electronic. You can get those practically in the Dollar Tree nowadays for $1. This one here is actually your temporal thermometer. This is your tympanic thermometer. This goes in the patient's ear. Just a review, make sure that you have the disposable probe on the outside of that. If you are using a temporal thermometer, you want to make sure that you are disinfecting all of these pieces of equipment in between usage. This is the picture here of the old glass thermometers that you can signify where they actually belong by the shape of them. If you see A, oral, the long tip one, this would be your typical oral thermometer. It says that you would see a blue color coating on the stem or the end. This also can show up as green for oral thermometer. And then your rectal thermometer has more of a bulb or a stubby tip because it's going into the rectum and you don't want to perforate anything inside. The rectal thermometer actually has a red color coating, and of course you would want to make sure that you had the protective sheath on all of these reusable glass thermometers, and that you weren't using a rectal thermometer in the oral cavity for obvious reasons. That would really be gross. Okay, so these videos, please watch them. It shows again the tympanic ear thermometer. There is test questions, so I'm not going to actually reveal that right now. I want you to watch it, of which way you actually pull the ear auricle to be able to open up the tympanic membrane, the ear canal, so that you can actually get that tympanic thermometer in to get a good reading of the tympanic membrane. And also oral temperature glass thermometer, you know you have to shake those down, how you actually have to read that as well. Now, babies and children, these are just basic averages, okay? As in a blood pressure, your average blood pressure being 120/80, it doesn't mean if you're a little lower or a little slightly higher that that's a bad thing for you. These are averages. So in babies and children, the average body temperature will range from 97.9 to 99 degrees. Adults, the average body temperature will range from 97 to 99. Also, depending on what route you are using or what type of a thermometer you're using, you can also get different ranges. Again, it doesn't mean that there's something wrong with your patient because you have a tympanic temperature of 97. Maybe you're taking it on a pediatric patient or a patient with dementia and they're having a hard time sitting still. You didn't get it in the ear canal properly, so you'd have to go and try and take that again. Also, the oral thermometer could be used underneath the armpit or for an axillary temperature as well. Adults over age 65, the average temperature can be a lot lower than 98.6. I ran into that frequently when I was in long-term care, that the body temperature in older adults and geriatric patients, they have a little bit of trouble maintaining their body temperature, and that's related to the loss of fat stores a lot of the times, and also just changes that are age-related with the body. Now your pulse oximeter, we have those little teeny ones just like this one here that we put on the finger, and we do the reading of the pulse ox. What it is signifying is the oxygen level in the blood itself, and it tells you about the patient's breathing status. Normal ranges should be above 95%, but if a patient has lung disease or sleep apnea, they could be as low as 90% on room air. And remember, room air is actually 21% oxygen in room air that you breathe. If someone is lower than 90%, certainly I would be worried about that. And if they were showing any signs of cyanosis, shortness of breath, any distress whatsoever, you would need to report that. Now, this pulse oximeter, it can also come in a more sophisticated fashion that can also be downloaded into the computers at the hospital. But the basic pulse ox over here is very good, it's very accurate. I had one that I used to keep on my med cart when I was working on the nursing units, and if I needed to check their oxygen saturation, it was a nice, quick, easy, convenient way to do it. It also shows you what their pulse rate is as well. Now, it can be affected by people that have like long nails, or if they have poor circulation in their fingers, their temperature is really cold. You may want to reposition that. You may want to rub their finger, take off that nail polish. If somebody has fake nails, it's not always going to give you a reading through that acrylic nail, or even so much as like a gel manicure. You could maybe have difficulty picking up that pulse oximetry reading. These 3 videos, this shows you and talks to you about how it actually works itself, okay? And then moving on to respirations. Respirations, this video shows you how to count the respirations. It's more of a direct care staff or nurse's aid skill. This is also showing inhaling, exhaling, how your diaphragm contracts and your diaphragm relaxes. So when someone breathes in and then they breathe out, that is inhaling, exhaling. Those 2 functions, inhaling, exhaling, counts as one breath. And that's how you count that. Your average person breathes at a rate of 12 to 16, but it also could be normal for someone to breathe 2 above or below, or just slightly out of the range. It doesn't mean that there's anything wrong with them. If someone is sleeping and they're in a deep sleep, they may be less than 12 per minute. If someone has a fever, the body could be trying to blow off some of that heat, and they could actually be tachypnic and have a higher elevated respiratory rate. That you want to also watch for. If there is an alteration in the amount of times that someone is breathing per minute, you want to look for signs and symptoms of respiratory distress. And that's kind of it for the video. This is just a little quickie. You have a good day now, and don't forget to do the quiz.